Dr. Fehrman, when a mom, has a baby, and what should she take care of as that baby is born and or as that baby starts getting the first teeth? What should she do or not do in order to start the process off right with the first set of teeth so that the second set of teeth has a chance of coming out correct? And by doing so, maybe, prevent all kinds of dental problems for the child, including less orthodontic work. Is there such a thing that if you do the right thing, the amount of orthodontic work could be maybe eliminated or at least reduced? I don't know. Tell us about it.
Great. Well, I think it certainly is true that the baby teeth are very, very important, and a lot of people don't feel that way. A lot of parents don't feel that way. They're just baby teeth. Well, they hold space for the permanent teeth. Because of the teeth, your child gets the ability to chew their food and be nourished properly. So the baby teeth are very important. And probably the number one worst thing that parents can do is put the child to bed with a bottle with either juice or milk or anything, because then that solution is on the teeth all night long, and it's very acidic or full of sugar or whatever, and it really, really affects the baby teeth. It can cause pain, discomfort, appearance looks horrible, but not only that, it affects the permanent teeth up above there, and as you know, those are forever. So the idea is to have excellent, healthy baby teeth, and that should pave the way for healthy permanent teeth as well. So you're right. If you lose baby teeth early because of a problem, like going to bed with a bottle in your mouth, it causes severe problems in the permanent teeth, much more involved orthodontic treatment then. So I'm not saying you could eliminate the need for orthodontic treatment if you just keep the baby teeth clean and healthy, but you certainly can make it a lot more involved if you don't.
I see. All right. It might not help the process that the teeth come out correct, but it surely might make it worse than it otherwise would be.
Surely would make it a lot worse, yes.
Right. Now tell me, what is, in terms of getting a child to brush and take care of the teeth, what suggestions do you have for a mom on how to go about to make the child compliant and get used to that type of stuff?
Well, I think you hit the nail on the head. Yeah, you hit the nail on the head. You have to just get the child used to it, and then it'll become part of their routine for the rest of their life. So it really comes right down on the parent, forcing the child to come over and brush your teeth like mommy is doing, and you show them yourself doing it first, and then you take the toothbrush in there and you do their teeth for them, and of course you let them help, but you have to go over it for them. Don't trust that they're doing a good enough job. You should do it for them. But I think it's imperative that you just do it every day and you just make it part of the child's routine. Flossing, the same thing. And then they just think of it as normal daily maintenance, and they'll do it the rest of their lives.
Well, just start them super early, right away, and kind of like when you say doing it for them, with them, basically what you mean is like take their hand and guide their hand and brush it and till they finally completely can do it on their own style.
Sure. I think it's fine to take their hand and do it for them, but I actually think it's important for the parent to just get in there and physically do it without the child's hand on the toothbrush as well. But then let them do it a little bit themselves too. And nowadays there's some good tasting toothpaste available for children, so they kind of like it. And it's a great habit you have to develop it young, and then you should have it made the rest of your life.
Okay. Well, good. Well, again, appreciate your information. I'm sure it is very helpful to people out there with children and getting them to grow up and to do the right thing. Thanks a lot, Dr. Fehrman.
You're welcome. My pleasure.